Thank you so much, Rob, and hello to everyone. It's really exciting to see you all. I was just saying as you were all coming in, well, happy Sunday and well done to everyone for getting up so early and being here with us. We've just got some slides we'd just like to share with you. Hopefully everyone can see that. So welcome to the Healthy Air for All session. We just got a couple of sort of housekeeping bits and bobs before we get going, if that's okay. So when you're not talking, if you could please mute your microphone. For those of you who know how to use Zoom or perhaps don't know how to use Zoom, it's a small icon just at the bottom of your screen. So if you wouldn't mind muting just when you're not chatting. Please also try to keep discussion respectful and to follow our safe space policy, which is to take space and to make space. Next slide, if that's okay. Please feel free to introduce yourself in the chat box, which, as you can see, is just below, just where you'll find the mute button as well. So please feel free to introduce yourself, where you're from, where you're calling from, and why you're here. That would be great. If you are having any tech problems today, then please do email the team. So Rob, who's just left us, or Ben. But also feel free to message the help channel on the WhatsApp group, and the link will be posted into the chat box for you to find that. And I think that's, oh no, yeah, so join the discussion on social media. For those of you who haven't already, we'll be tweeting on the @House for a Green New Deal tweet, and also using the #House for a Green New Deal hashtag. And I think TJ has just posted on the group the WhatsApp help channel for those of you who are having any tech issues. So let's get started. So as I said, welcome to all of you and thank you so much for being here. It's really great to see you all. My name is Vicky. My pronouns are she, her. I've been a Medact member for the past 3 years or so. I'm in the Medact Climate and Health Group, also the Climate and Health Research Network, and recently contributed to the report on the public health case for a Green New Deal, recently published by Medact. So I'm really, really excited to be with you all today to talk about an issue that I really feel is at the intersection between public health, environmental health, and health justice. So really exciting to be with you here today, and we've got a panel of fantastic speakers for you all. So let's just give you a bit of an introduction to what Healthy Air for All is all about. So as you may or may not know, up to 40,000 deaths just in the UK are attributable each year to poor air quality, with up to 7 million deaths globally. Its impacts really can be said to follow what we call a social gradient. So it really disproportionately impacts the most marginalised and vulnerable in our society. So in this session, Healthy Air for All, as I said, we've got an incredible panel of speakers, and we'll be exploring the issues around the health impacts of air pollution and why tackling it is really an issue of health justice. We'll be reflecting on what the just solutions to healthy air looks like as part of the Green New Deal. So we're really, really grateful to have the panelists who are joining us here today, so thank you so much. Just a quick note about the format of today's discussion. I'm going to explore these themes through some guided questions over the next 40 minutes or so. And then we're going to be opening up questions from you, the participants. So please do post in the chat box below. We've got a very helpful, handy volunteer who's backstage collating all the questions. So please do type them in, and we'll get to them after the discussion with the panel. So on our panel today, first up, we have Jemima Hartshorn, who founded the Clean Air Campaigns group Mums for Lungs, whilst on maternity leave in 2017 in London in the UK. As a response to the high and toxic air pollution levels and the lack of action for addressing it. So since then, Mums for Lungs has expanded widely to 3 groups in London, and they are campaigning on the most important pollution issues in London and the UK. Secondly, we've got Anjali, Raman, Middleton. She is the co-founder of Choked Up, a campaign founded by Black and Brown sixth formers, pushing for changes to clean air law to protect communities. And we also have Dr. LJ Smith, who is a respiratory specialist doctor working in South London. She's part of the Medact Climate and Health Group and a member of the Sustainability Steering Group at her hospital, who are campaigning on improving air quality. And lastly, we have Pascale Robinson, who is a campaigns officer at We Own It, which campaigns for public ownership of public services. She runs the campaign for Better Buses in Greater Manchester, set up and backed by We Own It. Better Buses is a coalition of passengers, staff, environment groups, older people and community groups that campaign for a better publicly controlled bus network. And in a recent success story, Andy Burnham has just announced that he was bringing buses into public control earlier this month. So we're really looking forward to hearing more about that from Pascal. So let's kick off the discussion. So as mentioned, this is really going to be a discursive panel where we're going to really go through with questions for the panel and really hope to have a really open, free discussion amongst them all. So let's start off with the first question, which is really about the kind of specifics on the health impacts of air pollution itself and the health injustices that cause them. So I wonder if you could tell us more really, what are the main health impacts of unhealthy air and how does this relate to health inequalities? And that might be a question for LJ or Anjali, or equally for anyone.
I'll start and then I'll perhaps hand over. So thanks, it's really great to be here, and particularly on this panel of people with such amazing knowledge and experience in campaigning. I think when you say those stats at the beginning, you know, the number of deaths that are attributable to air pollution, it's really shocking. They're really high numbers. You know, 7 million premature deaths worldwide, 40,000 in the UK. And so often we can think, well, how on earth have we got to this point where we have so many deaths? And how can that possibly be true? And I think one of the main problems is that air pollution is really invisible and so is often unquestioned. So whereas back in the day we might have got smogs that were very visible, air pollution now is tiny particles that we can't see. So the main contributors to air pollution that when we think about health impacts are particulate matter that primarily come from industrial energy and manufacturing industries and traffic, and also nitrogen dioxide. And again, that's generally from traffic in cities. And the way that these air pollutants act within the body means that they have many different effects. So the most obvious ones, I'm a respiratory doctor, I look after people with lung diseases. The most obvious effects are those on people who have asthma or COPD, smoking related lung disease, because they breathe in the particles, they cause inflammation in the lungs, and that leads to illness and premature death. But actually there are much greater effects, and air pollution affects every one of us from even before we're born. So there are effects in utero when mothers are exposed, right through the entire life course, not only affecting the lungs, but also causing heart attacks, dementia, diabetes mortality, anxiety, depression. You know, you name an organ system and air pollution will be causing inflammation, which has an effect on that. And this means that people are sicker for longer and will die earlier. And this is the reality of what we're doing every day. We're going out into the cities that we live in and we're breathing this in. And as you mentioned, although this does affect us all, it affects us disproportionately. And so there are some communities which are much more affected than others. And those communities tend to be the ones that actually haven't contributed the most to the air pollution. And I might just hand over to Anjali maybe to pick that up, because a lot of the work she does looks at the kind of inequalities and how, particularly in London, air pollution affects us.
Yeah, so we can definitely see in London that the people who live in the most highly polluted areas are people of colour and poorer communities. And this is something that we have to make sure that we are looking at in our work, because we can't have healthy air for all if we are just ignoring these people and ignoring these groups who suffer the most from it. And we can see that air pollution creates these underlying health issues that right now are really important, because they're one of the main reasons why people are dying from COVID. Like, that's something that make you a lot more susceptible to COVID deaths. And air pollution is one of the main, like, a cause for this. And so living in polluted areas can actually make you more susceptible to COVID and make you more likely to die from COVID. And we can see that it is BAME people who have higher mortality rates in this area. And I think that we have to see how a lot of these issues are really interconnected, and we can't just tackle that separately from tackling air pollution. And we can't tackle air pollution without tackling racism. And there are all of these little interconnected things that people tend to overlook that have to be tackled together. And without tackling them together, we just aren't fixing these issues. And I think that that's something that
Well, we've all been there. We've all been there with noise background. Karen.
Well, we just wait for the dog. I'll just chip in that there's a paper that I tweeted about earlier that came out just last week, which again is an examination of how there have been disproportionate severe COVID pneumonias and ITU admissions in people who are Black and brown. And so COVID itself is an illness that indiscriminately affects people, but actually that's not the case in terms of how sick people get and how likely they are to die because of all these underlying health inequalities. And these are not accidental things, they are things that are built into the structures in which we live. And this paper in particular, which I'll find the link for later, looked at specific things like housing quality, which leads to indoor air pollution, and air pollution specifically in terms of how it differently affects people, communities of colour. So there's really current evidence on this, it just builds all the time.
Yeah, and I really think that this is something that the environment movement generally needs to talk more about. And it's one of the reasons why I started this campaign Choked Up with other sixth formers who are also people of colour and also have lived experience of this. And I think that it's something that we tend to overlook. We tend to talk about the health issues and talk about them as if they affect everyone equally, when we just know that that is not the case. And it's something that we really have to think about, and we really have to examine our activism and examine how we are talking about this issue and making sure that we are approaching it in a way that takes all of this into account and make sure that we are looking at the intersectionality of it. We are looking at what is causing this and making sure we are attacking the root causes and not just air pollution generally. We're making sure that we are getting rid of this and stopping the inequality from ever happening.
Brilliant, Anjali, thank you so much. Thank you to both of you. I think, LJ, you mentioned some really, really key core points about air pollution, it being something that actually impacts all of us throughout the life course, which I think traditionally is something that we didn't necessarily think about when we think about air pollution. It's quite intuitive to think about air pollution and its effect on the respiratory system, for example, on our lungs and breathing. But actually, more and more we know the evidence shows that it's actually having huge impacts throughout the life course. And then, Anjali, you really kind of brought us into what is really important about this discussion, this debate, which is the interconnectedness of all of these environmental and equality and justice issues, which really is at the heart of why we're struggling with air pollution in the first place. So thank you so much for bringing that to this discussion, because I think that is really, really key. I want to move on to the next question, only because I think that it's probably going to tie in with what we've just been saying. And I'd love to hear, Anjali, a little bit more from you about Choked Up, about the campaign, if that's okay. So I wonder if the next question, which is, in what ways is healthy air an issue of health justice? Really, Anjali, you kind of touched on that, but I wonder if you could explain more and a little bit more about what you're doing in Choked Up.
Yeah, of course. So I started Choked Up with 3 other sixth formers in August last year. So we're a pretty new campaign, and our whole message and our whole manifesto is raising awareness for the disproportionate effects of people of colour and poor communities, and then making sure that we are carrying this into the legislation that we are creating, and making sure that we have legislation that takes this into account and protects these communities from what is killing them, and making sure that as we have lived experience of this, people are listening to us and making sure that people understand what is going on in the cities and in the areas that are by these busy roads, in these areas that are dangerously polluted, and making sure that this is an issue that people are talking about. This is an issue that the mayor is talking about. This is the issue that Parliament is talking about, and making sure we have actual legislation to protect us from it. So we recently have been involved in the Mayor for Clean Air campaign, and have been doing some work around the Mayor of London, making sure that when we vote in May, we are voting for a Mayor for Clean Air, and that this is one of the main priorities in this election. So we put up some hacked road signs about a month ago now, which said people of colour are disproportionately affected by clean air. They're more likely to live in polluted areas, and said pollution zone, breathing kills on them, just to make sure that people were aware of what they were breathing, and making sure that this was something people were thinking about. And sparked a lot of conversations, and it got a lot of people talking about clean air. And off the back of this campaign, we have been able to enter into conversations with some mayoral candidates. We have had meetings with the Green Party and the Lib Dems, and also Labour, and making sure that we're talking to them about what their policies are for the next Mayor of London, making sure that they are trying to clean up the red routes and stop the pollution along these roads, which are some of the busiest roads in London, because they are where the buses go. And these are the areas that a lot of people of colour and poor communities live along, simply because they are less desirable places to live and therefore are cheaper, but they also are the most polluted. And these kind of issues are something that are really important to remember. And so cleaning up the red routes is one of the main things we want to see from the next mayor, because we think that it will clean up the air for everyone and work to limit and start to tackle this inequality. We also want to see ULEZ expansion, because we think that the ULEZ has been pretty successful, and we want to roll that out to make sure that people are generally breathing cleaner air. And yeah, so, and also zero emission bus fleet as soon as possible, by 2030 at the latest. And so we've had lots of conversations with mayors, well, the mayoral candidates, making sure that they're trying to do all of this, making sure that they're taking this as the priority that it should be. They're making sure that it's treated with the concern and the urgency that it really requires, because there is no reason why we can't start cleaning up our air today. It's something that we know how to do. It's something that we are capable of doing. And the way that it has been delayed, the way that people just aren't thinking about it, is completely unacceptable, because people are dying from this. People are living with dirty air every day, and no one is doing anything about it. So we also have a Mayoral Hustings on Tuesday at 7:30, where we will be examining the candidates' clean air policies, asking them all about what they intend to do to tackle this issue. And so you can sign up for that on the Eventbrite. The link is on our Twitter, as well as the Mums for Lungs Twitter. And so that's pretty much what we've been up to recently. Yeah.
I'm amazed that you only set up your group in August and you've managed to achieve so much. I think any of us who've had any campaigning experience will be absolutely blown away by the amount that you've managed to achieve in such a short time. So well done to you. And I think it's so relevant what you've really picked up on, and it kind of links into what LJ was mentioning, that air pollution really is kind of the invisible killer, as coined by the WHO. It really is something that is urgent. It's a public health emergency. People are breathing in this air every single day, and we really need to be treating it with the urgency that it deserves. So thank you for bringing that to the forefront, really, of this discussion. I'm going to bring in Jemima here, because I know that the London Mayoral campaign is something that Mums for Lungs has also been working on. So Jemima, if you want to come in and tell us a little bit more about Mums for Lungs and about how you've been working with Anjali and others with the London Mayoral campaign, that would be great.
Yeah, thank you. Well, I think Anjali has gone into quite a lot of detail already, but it's been really good. So Mums for Lungs, we've been campaigning for about 4 years now, and we were very vocal in the past 4 years on different issues, including obviously the expansion of the ULEZ, which we had hoped would cover all of London in 2018 when we were campaigning on it, and other issues. So, this feels just like sort of a good and natural alliance to come together with a few other groups. So Medact is a part of this Mayor for Clean Air collaboration, and it was all really coordinated, I would say, by EDF Europe, European Defence Fund, on this issue. So that has been really exciting, and has been really strong coming together on different issues of inequities, because there is a huge inequity, as Anjali has really made very strongly just now, about different demographics being strongly affected, and about race and social classes and income and things like that. There's obviously also inequities around the impact of air pollution between ages. So younger people, children, are much more strongly affected, simply because they're closer to the exhaust fumes and because they breathe more deeply. And which has sort of been my driver to get involved in clean air campaigning. And children are, again, also one of those people who don't really make the choices. They don't usually have the choice whether they drive the car to school or to wherever they go, and they don't usually choose the route and things like that. So there's inequities on all kinds of different levels, and it feels like, doesn't just feel like, but I think it is the case that all those inequities that we see in this society on a much broader basis are sort of hyper emphasized in the issue of air pollution again. Also, I mean, it's a lower level in most cases, but women are going to be more affected by air pollution in many cases because they usually do the school ones, which is the time that you have the air pollution across London is the highest as well, you know. So it's just very, very sad, and it needs absolute urgent priority from the mayors, the next mayor. So a lot has been achieved over the last few years, but we're really keen to see much more changes. And one of the things that Mums for Lungs is really campaigning on is school streets, which is closing the roads by schools, which have absolutely mushroomed. There were about 80 school streets a year ago, and there's about 350 school streets now. And we work a lot with a network of over 1,000 parents, empowering them to campaign on this issue. And the problem, obviously, with school streets is that they can only be introduced at certain roads, because on really big roads in our current society, we believe that the car needs to have a priority over people getting to school and being at school without being polluted. But I do feel that they are really good at raising awareness, because especially if you have a kid at a school where you have a school street, you think it's great, and if you have a kid at a school where you don't have a school street but see other school streets, you feel that is unfair. So there is a real snowball campaign sort of happening, that people are getting in touch much more and saying, look, I've seen the school street, I don't want to take my kid out of the school they're at. So what can we do about the main roads? What can be done here? So there is some, you know, it feels like it's a segue as well as a really strong campaign element to raise awareness amongst all people, especially parents, obviously, who have the school experience on a daily basis.
No, absolutely, and I think that Mums for Lungs and other other kind of community groups, parent-led community groups in air pollution is really, really an interesting part of the campaign, I think. And I think Mums for Lungs are kind of the spotlight example, where we're really looking at the people who are campaigning for those who are most affected, which are children and vulnerable groups. So I think it's a really fantastic campaign that we have parent-led groups within the campaign. You've also touched, Jemima, there on a couple of kind of solutions, really. What are the kind of air pollution solutions? Because that's really where we want to move this kind of discussion forward. We want to say, we know that air pollution affects our health. Where do we go from here? So I think you've mentioned some really, really interesting initiatives. So school streets, for those of you who don't know, Amy has very kindly posted the link in the chat below. The School Streets Campaign initiative, which, as Jemima said, is all about closing down school streets during the school run times. It's all about stopping idling cars, etc. So it's a really fantastic campaign that has really taken off across the UK, and I would encourage you all to have a look at it. I want to come back to you, Jemima, about specific solutions, because that's where I'd love to move this discussion onto, but I think it'd be great to bring in Pascale here at this point, who has some fantastic experience of a bit of a success story really for the air pollution campaign, and I think it'd be brilliant to hear from you and from what you've been doing in Manchester.
Thanks so much for having me. It's amazing to learn from amazing campaigners and academics, and it's fascinating to hear about the London context. I'm from South London, and I work in Manchester, and I spend most of my time thinking about Manchester buses. So hearing about London buses in the detail and how they can be much better is really interesting. So yeah, we've been running a campaign for 3 years here in Greater Manchester, calling for our buses to be brought back into public control. And that springs from the fact that in the 1980s, Thatcher deregulated buses. She demanded that councils sell their bus services and basically allowed bus companies to be in complete control. So bus companies choose the fares, the routes, the tickets, everything basically, and London was one of the only places that was allowed to keep public control of its buses. It was deemed too risky because London's buses had to be kind of functioning, whereas the rest of us were kind of subject to this experiment, which has, I mean, apart from the bus operators, everyone agrees basically that it hasn't worked. So what we've seen is in Greater Manchester, for example, our bus use has fallen by 40% since 1986, and in London it's doubled, of course, because there has been brilliant work there done to invest in the network and to expand it, etc., to make it more affordable. Certainly not good enough, but so we have been working on this campaign. We've been pulling together a coalition of, as Vicky mentioned, passengers and staff and environmental groups and unions. And we've been basically calling on Andy Burnham to be the first mayor since Thatcher deregulated buses to bring them back into public control. We were really ecstatic that a month ago, it wasn't a month ago, it was like 2 weeks ago. Time is strange in a pandemic. Maybe yesterday, Andy Burnham announced that he was going to bring buses back into public control, which we're really excited about, because as much as London's buses need huge improvements, for us in Greater Manchester, we look to London as a model of what our buses could be like. So of course in London, the mayor can set the fares. So you have £1.50 fares. In Greater Manchester, they can be as much as £5 for a single journey. That you often need to get 2 different tickets because various different operators run the service. And there's a whole other host of problems. But the long story, but maybe specific to air pollution, is that they have for the last 30 years just not invested in the fleet at all, and so we have these really disgusting, quite frankly, dirty buses, and that was something when I moved here that you really noticed, you know, this kind of big black smog coming out the back of a bus, and that's what led lots of people to get involved in the campaign. Meanwhile, the government has given millions and millions to the bus companies to slightly improve their fleet, which they then say, oh look, this is an example of bus operators being in control, that's why we should continue to be in control. And you know full well that that's public money that they're then using to try and stop campaigns to get more control. I apologize, I've spoken quite a lot, but yeah, that's kind of a brief overview of what we've been doing in Greater Manchester.
That's fantastic, Pascal. I want to ask you, I think I've got a million questions on the top of my head that I want to ask you about your campaign, because I think it's a really, really spearheading campaign. And I think it's just fantastic. And it really, really brings us on to what we want to kind of talk about really, which is, again, solutions. Why public transport is a solution to unhealthy air. And I'd like to get the panelists kind of discussion answers on that. But Pascal, just while we have you, I'd like to just ask, why do you think it is that public ownership of buses is so important in terms of answering the unhealthy air question? Yeah,
so what we've won in Greater Manchester is public control of our buses, as opposed to public ownership, unfortunately. In 2017, it seemed that public ownership of buses was actually illegal, but recently the new national bus strategy has slightly updated that, I think because they know that that their ideological hatred of kind of publicly run services is just not functioning, it's not working. The reason we believe that public ownership of our services, and particularly transport services, is crucial to us achieving a just transition is because, of course, the greenhouse gas emissions from the transport sector are absolutely shocking. They're, I think, the only sector that is increasing its greenhouse gas emissions, and a huge amount of those emissions comes from cars. And of course, we can't penalize people and say to them, you cannot use a car, I think, unless we're offering an alternative. And that's what our political representatives should be doing. They should be working night and day to get us working great transport systems. It's it's the difference between being able to access, you know, your loved ones, jobs, hospitals, services, having a decent bus service, and it completely holds back entire regions. But specifically with regards, of course, to why it's so important, when we have control over a transport system, when our political representatives are more responsible and have a stake in that in that transport system, we can start to put effective pressure on them, so that amazing campaigners like Anjali have a hope of getting decent transport that doesn't kill people, quite frankly. For example, in London, of course, the mayor has been able to say, we are going to transition. We demand that those bus companies introduce cleaner, healthier buses. But of course, you can go one step further when you own the network. And that's what we've seen in Nottingham. So Nottingham is, of course, a relatively small city in the UK, but it is an absolute world leader. It's one of the only places in the UK that has a publicly owned bus network. And because all of the profits from that network can be reinvested, it has one of the best, most comprehensive bus services in the country. It has been a world leader. In 2017, it had the largest fleet of green electric buses. It was a leader in developing that infrastructure for charging, and their tram network was what do you call it? The energy that they used was the Robin Hood green energy company, which unfortunately no longer exists. Once you have control over your transport, you can start to transform it so that it works for people, not for profit.
That's it, and I think that's the bottom line, isn't it? It's working for people and not for profit, and that really harks to kind of what we're trying to achieve, which is system level changes, really. So thank you so much, Pascal, and I apologise for my error about the ownership and control. I'd like to just open the floor really to the panelists before we move on to the more questions, because I think this is a really, really key part of the debate. So Anjali, Jemima, LJ, I wonder if you have any responses for Pascal or any comments.
Well, I think, thank you so much. It sounds really exciting, and I'm so curious to hear, because I used to work for UK 100, which is an organisation that works with local authorities on this issue, and we were always talking about Nottingham, obviously, so it's super exciting to hear that so much change is happening in Manchester as well now. But it feels to me that, but I might be wrong, but for me, the crucial point is always awareness, and I feel that we've sort of all come to this world, and we're sort of, most of us are accepting of the circumstances. Air pollution feels quite invisible. The bus system is as it is. Out of the end of the bus, you see whatever comes out, and it costs as much as it is. And I think the real problem in all these changes is the lack of awareness. And I think when people like Pascal, or everyone here on the phone, on the call, sort of take steps to raise awareness, it is really interesting that then we get real support. And I just feel like that is the heart and the core of all these air pollution issues, and frankly every other issue we have in society, right? And I'm just really upset, and I would be keen what the other panelists think about that, is that there has been so little awareness raising, and we've been badgering all levels of government for 4 years to do a real public health campaign, and what we have seen has been really tiny, mediocre, in some cases completely misleading, just as Pascal mentioned as well. You get government gives the bus companies a bit of money, they make slightly better buses, and that almost has the opposite effect. It reassures people that things are actually okay, which I feel has been the same in London. And the national government, they're doing this terrible environment bill, which is not strong on air pollution, doesn't have any teeth, and they're like, oh, we're on it, don't worry about the environment, we're on it, we're coasting COP26, we're on it. And it is just really difficult. So there's a huge amount of people who are unaware, then there's those people who are aware to an extent what's going on, but are reassured by government, and then you only have a small number of people left who are like, this is not okay, we need to start taking action on an absolute shoestring in their spare time while juggling all these other things. And that is I think, where sort of it almost feels easy for government or policymakers to stop any change by just doing tokenistic efforts and by not really running clear public health campaigns on any of these issues. Sorry, that was a bit of a random.
Don't apologize, that was great. I think we need a bit more anger about this, to be honest. I think what people have said really brings out the issue that actually, when we think about air pollution, that might be certainly what I'm seeing in my clinic. But if I approach it only as a problem of air pollution, we will not solve the problem. And you can't spend all your energy on a single issue because it's only part of a bigger picture. And that's what things like this, bringing the people together with different perspectives are really important, and to see the wins from other places and to say how can they be applied. But I guess it comes back to the idea of, well, what are the solutions? The solutions are bigger than just small fixes to do with a single fleet. We can campaign in our local areas on issues that are very relevant to us. So there are things that are specific to London that are immediate targets that we're campaigning on, but that's part of a much broader, bigger campaign about fixing the system that has got us to this situation in the first place. And that's a big ask because the system is capitalism. The people who are currently driving around in their SUVs are undoing all the work of people who are reducing the amount of traffic that's driving around. There was an article out this week that all of the gains from switches to electric vehicles are completely wiped out by the increase in SUV usage. So there's a bigger structural issue here. And if we only focus on a switch to EVs, that's not it. That's not the silver bullet. That's a bit of greenwashing that some companies are into. We need to decrease traffic completely. We need structures in place that mean that it's not possible for us to just constantly breach the limits set by the WHO, and that to just be a normal thing. Oh yeah, another day where we've completely breached anything close to a safety limit. There is no safe level of air pollution. That's been proven again and again. But even the arbitrary safe limits, we just breach every day as if it's no big thing. So I think it's about tackling this at a much bigger level, and that's, I guess, where the Green New Deal comes in, and this thought about Build Back Better and changing the structures that create these situations of both economic, social, and environmental injustice.
Absolutely. I think that was fantastically said. Absolutely. Anjali, did you want to come in?
Yeah, I just wanted to add on to that point. I think that there is a lot of surface level activism that a lot of people engage in, where they see an issue and they don't want to go to the root cause of it. They want to just tackle that issue and not address everything that underlies it. And I think that one thing that I've seen a lot in recently, which I think is really good, is a lot of people understanding more about the systems behind these sort of structures, and like why air pollution is an issue, and like how you have to unpack it to look at race, you have to look at poverty, you have to look at capitalism and all of these structures and why they exist. And I think that that's something that we all have to really focus on. And I think it's really good that we now have a network of people who are talking about that. And even though that hasn't yet extended into the political sphere, and whilst a lot of politicians are still hesitant to talk about issues in that sort of way because it compromises their position and then they have to actually do stuff about it, it is something that a lot of people now are starting to get angry about and starting to want to see that sort of change. And I can definitely see that among my peers and people my age. And it does kind of make me hopeful that something will end up happening. And your campaign, Pascal, sounds so incredible. And the fact that you were able to do that is really quite amazing and really quite hopeful for the future. And it makes me think that maybe it's possible to get public ownership of bus networks all over the country and actually start tackling that issue at its core instead of just trying to focus on it superficially with the current systems that we have. Yeah.
Absolutely. I think all three of you there have really touched on the fact that we're really dealing with an issue that is one issue within the bigger picture here, and it's really that which has kind of brought us here together, because it's really how the systems, the kind of the social and economic and political systems in which we live and which we take for granted every day, how is it that is actually making us sick? And one of those ways is through air pollution. So I think it's really fantastic that we really highlighted just how interconnected these issues are. I want to just move on to, you spoke a lot about, LJ, you mentioned electric cars, you mentioned greenwashing, which I feel is an absolutely essential part of the debate. I feel like in terms of the solutions that we have, now Pascal has mentioned their fantastic campaign in Manchester. Jemima, you mentioned some fantastic campaigning as well, some solutions to specifically kind of community level changes that we can make. In terms of solutions that we have on a system level, community level, is it important, and how is it important, and how can we achieve kind of community ownership of these solutions? So how can we make sure that communities have a stake in air pollution reduction initiatives to make sure that actually communities are the ones calling the shots? That is really open to everyone if anyone wants to come in.
So I would just reiterate, I think it's firstly about awareness. People need to know what the issues are, and secondly, how to get involved. And I think it's really strongly a point about resources as well, because if we're thinking about local level change, that would be driven by local councils in most cases. Local councils have been absolutely starved for many years, and they don't really have enough engagement officers. They don't have enough people to think more holistically about the things. They are just under so much pressure, completely understaffed and under-resourced. And I think that is a real problem, and resulting in sometimes decisions being taken without enough communication. It's, you know, it's that basic kind of stuff. If you don't have the time to go out to talk about what you're planning to do or what the problem is that you're planning to address, it makes it much harder for communities to get involved, and then shots get called, or have to get called, or don't get called, but in the end everyone ends frustrated. So I think it's, you know, awareness, but very strongly we really need national government to provide whoever wants to do change or is the policy maker with the funds to make everyone be able to get involved.
I think it's such a good question. How do we ensure that communities are given ownership on the initiatives that are happening? And because what we see when this goes wrong, so the classic one, particularly in London but elsewhere, is the low traffic neighbourhoods. And there's so much anger about these, and it has then led to conversations entirely focused on low traffic neighbourhoods as if they're the only solution to air pollution. And so it really causes lots of problems. And what's happened with these is there hasn't been sufficient consultation. So overall, there was a strategy to introduce more low traffic neighbourhoods with the aim of reducing overall traffic. That's what they're planning to do. And there are plenty of examples of where that has been successful, particularly in Europe, but also in the UK and certain parts of London. But what doesn't work is when you have no consultation with the local people, you bring it in, and then there are disproportionate effects that are not perhaps planned, but are just, you haven't talked to the people who live there. So of course there are going to be consequences that you don't know. You don't live there, you live somewhere else. So by implementing things at pace without sufficient consultation, and then having to deal with the fallout, then now low traffic neighbourhoods have got this terrible rep. And so that's a real problem, because if they're implemented well with consultation and with a discussion about, okay, if we do have a low traffic neighbourhood here, we're closing off this road, what will be the impacts? You know, it's such a kind of town planning 101 to say, well, if we do this, what's the very predictable thing that will happen? Oh, there'll be more traffic here immediately. Again, evidence shows that over time overall traffic reduces, but that doesn't help those people on the main road who've just had a ton more traffic, and they are often people who are of lower of socioeconomic disadvantage. They're on the busier roads, and they're not people who can move. This is again part of the injustice. It's like, well, what are the solutions for those people? They can't just move. They can't afford to. They are probably people who are not car owners in many situations. We haven't really talked about Ella Kissy Deborah, but we can maybe mention that. But her mum is one person who has been asked about this a lot, and she lives in Lewisham and has been affected by the implementation of a low traffic neighbourhood, and her kids she cycles, and so she's affected by pollution from traffic that she is not contributing to. So there's been a big failure to do that, and therefore, you know, now we're having to deal with this consequence and having to have conversations that are a distraction from the overall. LTNs are one part of a much bigger strategy about what we do about pollution, and so it's very distracting. So I think it's a real lesson to not do this again. We need better consultation, and not just consultation, true involvement, because people who have lived experience also have solutions. And when we don't listen to them, then we fail everyone.
Sorry, can I just just add to that, because I think our points sort of really matched up, because what happened is that councils were offered money in May and it had to be spent by the end of September. Like, there was no time, no staff, no plans, no anything. Like, and that is just, you know what I mean? That's what I mean. There's not enough resources to work through these solutions properly. And then exactly as you say, that sort of happens. But I just wanted to give that as a background, that was just, you know, basically giving people no time and just money to do something is just sort of the epitome of how to do things wrong from a national government perspective.
Absolutely, yeah, absolutely. I wondered if Anjali or Pascal, I have a very specific question for you about how, just mentioning consultations, and LJ and Jemima just mentioning community awareness and involvement and how crucial that is. I just wanted to hear from your experience, how the consultation process, the kind of community involvement process, how that went in Manchester. But I also wanted to see if Anjali wanted to pick up on LJ mentioning Ella's case, for those of us on the call who maybe don't know about Ella, or I know that Choked Up often mention Ella, so I wanted to kind of give you that voice piece for a second before we go to Pascal, if that's okay.
Yeah, so I can quickly talk a bit about Ella. So we at Choked Up, we talk to Rosie, Ella's mum, quite a lot. We have quite a good relationship with her, and so we've seen a lot of what she's been doing, and she's been one of our main role models as like a woman of colour in this space, and as someone whose own story is so incredible, and her own fight for this has been one of the main reasons that air pollution is now a main concern in the eyes of the government, because she has made a really compelling case, and her own personal loss has been extraordinary and just so heartbreaking. And so yeah, it was a really huge loss for my community when Ella passed away, because I went to school with her as well, so it was something that I was involved in the fallout of. Like, I was able to see what kind of effect that had, and when we found out that it was air pollution that had been the main cause, it was something that I remember had grown slowly. Like, it wasn't something that we were aware of at first, because obviously air pollution is an invisible killer, and so everyone just thought it was her asthma that had done it. And then all of these stats got released about air pollution in the area, and we started to realise that it wasn't as simple as that. And her mum started to get more and more angry about this death that could have very easily been prevented. And she's just phenomenal. She is an extraordinary campaigner, and her resilience in the face of all of this has been quite remarkable. And she has been one of the main reasons why I have been so passionate about this, and one of the main reasons why I've started to get involved in this movement. And yeah, so Ella's death is something that was so heartbreaking because it was so preventable, but something that I hope will lead to extraordinary change, and I hope that it will never happen again.
Thank you so much, Anjali. It's so important to share her story, so thank you for that. Pascal, can we maybe chat a bit more about the Manchester experience and just kind of what we were chatting about with community involvement and the kind of consultation process, if you've got any experience of that for us that we can all kind of take forward from this?
Yeah, yeah, so I mean, when I first saw this question in the kind of shared questions before, I was quite intimidated by it, and then actually it's occurred, kind of hearing all of you speak, that I actually think that the way we ensure communities are given ownership of air pollution reduction initiatives is through campaigning, through amazing campaigners like Anjali and you know, and Mums for Lungs, etc. Like, we can see kind of Sadiq Khan introducing cleaner buses. We can see the bus companies introducing cleaner buses, and we can think, oh, that's being done, that's fine. Like you say, there's that kind of notion of progress. But the reality is that when out of awful pain, campaigners like Anjali create amazing community initiatives and articulate clear demands that politicians have to demand, it's incredibly powerful. And the creative actions like the billboard are incredibly, you know, they capture people's imaginations, and they do that work of making visible what feels invisible. So I just think that's incredibly important, and that we should remember how important campaigning is for changing the narrative and having that impact. And you know, in Greater Manchester it feels very exciting, but I'm much older since starting this campaign. I was youthful when I started this campaign, so it does take years, and we will win eventually. But sorry, Vicky, to answer your actual question, with regards to the consultation, we basically made the consultation the kind of the last point of our campaign. And an amazing campaigner said to me, Pascal, don't make the consultation the end goal. Make the consultation just another part of your daily work of bringing this issue up the agenda, articulating demands, being creative, bringing people together. And so, yeah, we kind of did that from the start. Basically, we were constantly thinking about our target. We were constantly thinking about what would move him, what makes Andy Burnham tick. And for us, we know that he cares about how we're seen in the media. He's keen to be seen, to be listening to communities. So we brought together a really broad community, and we mobilise people all over Greater Manchester. So for example, years before the consultation happened, we brought people together at a barnstorm. We asked people to commit right there and then to group together with strangers in their local area and meet with their local council leader at a bus stop or on a bus. And it was things like that, getting local press, etc., that brought that issue, I'd like to think, up the agenda so much so that when the consultation came, we had communicated and brought people together to say, yes, we want public control of buses. We know exactly why that will be better for our communities. It's got a £135 million price tag, but we as a community know that it's worth that investment. And we got there well before the bus companies could tell their narrative. And the bus companies will try, they will spend millions trying to tell their story. So it's so important that we come together as campaigners and creatively get people's attention and make them feel like they can take meaningful action. When Angela Davis says that, like, when people exactly like you feel like they can make change, that's when really transformative stuff happens.
I think that's exactly it. I think you've hit the nail on the head. I think bringing communities together with a real strategy to kind of build a movement, that can achieve what we want to achieve when it comes to air pollution. I think what it would be really interesting now to kind of discuss together, just in terms of building this movement and working together as a community. We've kind of mentioned how important it is for us all from various walks of life, why it's so important for us all as a community to come together and what we can build together in building this movement. And I think that's really what the Green New Deal, the House report for the Green New Deal, really is all about. A question for all of you really would then be, how do you think that we can work together, specifically kind of LJ and other health workers? How do we build the health community, the kind of public health community, into the larger movement? Because we know that the health voice within the air pollution campaign is crucial to really, well, you can tell us why it's crucial, LJ, but that's only one voice amongst many, and we need all of the voices. So it'd be really helpful to hear from you how you envision us working together in kind of solidarity in moving this debate forward.
I could definitely answer what I think. It's just my opinion. So I think healthcare professionals have a real responsibility, and it can sometimes feel like it's too big to fix all these problems. So I'm sat there in my clinic, in my respiratory clinic. Patient comes in, they're having a terrible time, they're having loads of asthma attacks, they are using all their inhalers, I'm prescribing them increasing doses of their inhalers. You know, that's me doing my job, and that's fine, but I'm sending them back out into a situation where that's driving their illness, and then they're back in again. And so, yes, I'm doing my job by knowing the guidelines, knowing the evidence, prescribing the right drugs, but that's a very small fraction of my job, and I have to think wider, and we all as health professionals have to think wider. No, I don't know a single doctor who went into it thinking, you know, I really want to prescribe some drugs. They went in thinking, I want to save lives where possible, I want to always decrease suffering, and I want to maximize health for every single person I have any contact with. You know, that's what we're supposed to be doing. And air pollution is such a good example of where we're completely failing our patients. So I think one thing that's useful for healthcare professionals is to come back to the GMC duties of a doctor. I'm just going to read a couple out because I think they really resonate with this campaign. So one of them is, take prompt action if you think that patient safety, dignity, or comfort is being compromised. So prompt action, that means we should have been doing this yesterday. Support patients in caring for themselves to improve and maintain their health, and protect and promote the health of patients and the public. So it's written in to our duties as doctors that we have to be involved in this work. So I think that's, that's where we kind of need to start from. This is part of our work. This is part of our job. We're not doing our job properly otherwise. And then I guess that, there are some practical things. So I think one, we have to remember that we're individuals. So we need to think about how we as individuals are traveling. Am I driving to work? Am I cycling? What am I doing in my own community? Have I got a wood burning stove? Well, I need to bin that immediately. I don't want to be creating pollution for the people I'm then treating in my hospital. So we need to think about our actions as individuals. We then need to think about our actions as community members. So is there a Mums for Lungs campaign going in my local community or something similar? And how am I, as a community member, supporting that and doing that work? And then specifically in terms of what we're doing in our own organisation. So one of the things we've talked about is the importance of thinking about traffic, particularly in cities. 5% of all traffic is NHS related. So again, an institution that is trying to support health is also contributing to the problem. And there's actually lots we can do about that. So I'm on our sustainability steering committee, our hospital, which is very newly formed. We had our first meeting about 2 months ago. But all hospitals have to have a green plan. Within that green plan, they have a responsibility for air quality as an anchor institution in their communities. So there are frameworks that are more and more kind of being built up. We are developing links with our local councils who actually are doing loads of good work, but it needs linking up. And then, we need to think about the power of our voices. So healthcare professionals get disproportionate airtime on these issues. And that's, yes, because we're experts, but we're experts in the theory. We're not actually experts in the lived experience. And so we need to both use our own voices to be powerful in this campaign, but also think about how we can amplify the voices of others. And particularly, that's why this campaign has been so fun to work on, because Jemima and Anjali are way more creative than I am, and their campaigns are just really fun to be part of. They're thoughtful, they're creative, they're eye-catching, they're full of information, but also in such a great way that's way more accessible. But also, our knowledge is different. It's not that my knowledge is greater than theirs, it's just that we come from different perspectives, but together that's such a powerful force to then demand change from those who have the power to do so.
Absolutely, thank you, LD. That's it'd be great to hear from Jemima, Anjali, Pascal. Jemima, yeah, go ahead.
Yeah, so I would love to add a point, because I'm really, to be honest, quite upset that in 5 years of motherhood, no doctor has ever mentioned air pollution to me. I've been in hospitals with kids having bronchiolitis, babies repeatedly. My son was hospitalized. We lived on Cold Harbour Lane. We were in which is a big road, which I'm quite sure that the local doctors would see. They knew where we lived, so they would know it is a big road. Things like that, it's never been mentioned. And I have spoken to hundreds of parents in the last 4 years of campaigning, and there's only 2 mums or pregnant women who had any comment by their midwife or doctor. And one of them has a very, very sick kid and goes through the respiratory real concerns. He's had life-threatening asthma attacks. So she has been told to avoid trafficy roads, but no one else. And then Celeste, one mum I campaigned with, had a comment when she had very bad readings through her pregnancy, that the midwife just said, "Oh, that's because you cycle." But the very vast majority, I'm talking about another 180 moms or more I have spoken to, have never had air pollution come up as a topic, as anything saying, look, this is an issue. You're here with bronchiolitis with your kids. Think about where you walk. Think about driving, because air pollution can be higher inside the car. Think about your wood burner, and perhaps do not open the front windows at certain times. And that is just something we really would wish to see, because midwives and doctors are so trusted, right? You don't go to your doctor and they say your appendix needs to come out, and then you say, "Oh, I'd like to discuss this with a few other people first." You know what I mean? Like, in so many other professions, we ask for another view or want to think about it some more. With doctors, you don't. So if the midwives said, listen, London is a polluted place, please think about it. If doctors said that, that would make such a huge impact. And that is not happening. And I think that is really adding to this idea that air pollution is either not a thing or not that badly of a thing. Because if it were a bad thing, we would be told about it. My dentist has told me to not give my kids sweets. But yeah, sorry, I've made my point, I think.
I could not agree with you more. I could not agree with you more. I think it's a huge gap in medical education and in what we do, and I could not agree with you more. And I think that we are not doing enough as a profession. I completely agree.
Or like flyers, you know, you get random flyers saying, watch out with this kind of accidents or something. And even the bronchiolitis flyers don't mention air pollution as something to consider around your small babies or so, you know.
No, I agree. We talk about smoking, we talk about alcohol, we talk about lots of other public health risk factors, and air pollution barely makes it. No, I completely agree. I'm very aware that I want to get to questions, because I know we've got a lot of questions and we've only got about 20 minutes left of the session, but I just wanted to let LJ, Anjali or Pascal have a kind of final comment on this session before we move on. If there's anything that you'd like to say at this point.
I would probably just like to say, with the mayoral campaigning, we have the hustings on Tuesday, and it would be great if you guys could attend and just ask the mayoral candidates questions about their clean air stances, just see what they have to say, and then let that influence your voting. Because obviously, like, I can't vote, I'm only 17, so like I am relying on you guys to vote for something that is gonna help me and vote on my interests as well. So that's pretty much it.
Thank you so much, Anjali, and I for one can't wait until you're allowed to vote. Right, okay, let's move on to some questions. I am just going to pull up the question deck. Yeah, we have quite a few. Let me just have a quick look. Okay, we've got, what I will do is, just because we've only got 20 minutes, I'll probably just run through them. I've got the name of who asked the question, rather than going to you directly and asking you to say your question yourself, if that's all right. But if anyone would really like to kind of say their question themselves directly to the speaker, then please do say in the chat, please come to me. Otherwise, I will go through them just in the interest of time, if that's all right. So I've got a first question from Sarah. As we agree on a global fight, healthy air in low resource settings, so we have lack of energy using traditional methods, so charcoal, burning logs, newspapers to cook, and warm water and boiling milk for kids. This is recognised as a significant trigger for children and young people's asthma. So the limitations of access and cost of energy and resources, so solar power, etc. I think that question is probably about what is the kind of global perspective, because we've looked very much at kind of the UK and particularly London perspective, but this debate can be absolutely extrapolated to the kind of global level. So I think that's a comment on that, really, if anyone would like to come in.
Just to say that absolutely this is a global issue, and of course we're focused in London. We live in London, we're campaigning in London, and London has the highest air pollution in the UK. But if we look globally, if we look at places like China and India, it's absolutely horrific. And we saw during COVID, you know, there was such a reduction in people moving around that they actually saw the mountains again. You know, it's ridiculous. The kind of particulate matter is so bad in some places in India that it's visible, as well as all the invisible stuff we've talked about. I guess one thing to think about in terms of how this fits in with what we're doing and the actions we take, one of the things from the Medact report talks about thinking globally and acting locally, and it's part of the reason why things like a switch to electric vehicles is not the solution. So we need to reduce our reliance on cars overall, because even to produce electric vehicles requires minerals and mining and extraction from places abroad. And also kind of on a personal level, you know, all the things that I buy are often made abroad in places where people are then forced to live and work in areas of high air pollution, in industrial places, to create the things that we then buy and ship here. So yes, it's very much a global justice issue, and there are places in the world who are really struggling. There are good solutions to things that were specifically mentioned about things like stoves, there are good tech advances, but of course they have to be funded and to get into those communities, which is another thing we should be giving more in aid to overseas, but that's another debate.
Yeah, I think something that's really quite compelling to me about pollution abroad is it's not just in cities, and that it's also really bad in rural areas. And also, once again, like the intersectionality of it, because women in like globally, like in India, because I'm half Indian, so I know a bit about that, but women in India are more likely to be affected by air pollution because they're cooking, and the things they're cooking with are highly polluting. And in fact, my great grandmother had some really weird lung disease that everyone thought was asthma, but looking back was 100% caused by her cooking like all the time over this really quite polluting burner. And so these kind of issues are really hard to fix, especially when we're looking at it from like where we live in London, where we live in the UK. Like we can't, it also feels slightly weird to try and help them out and try and give aid, because it's again like some kind of weird colonial mindset and white savior mindset where we have to try and help them. So I think one of the best ways to just deal with it is to reach out to people who are living there and trying to do the same thing. So what we've been talking a bit about Choked Up about reaching out to other organizations globally. And so we've entered into some very preliminary conversations with some clean air activists in India, just seeing what ways that we can help them, like listening to what they want, listening to what they need. And I think that that's probably the best way to deal with this, and just trying to support people by asking them what they need and just seeing how you can help them, how we can help them from our position here.
Absolutely, and I think that harks back to what we were saying about actually letting things be community led, you know, and that should be happening locally and it should be happening globally. So absolutely, thank you so much for answering that question. I've got another one for the panel. So this is from Jasmine. Many of the panelists have spoken about the invisibility of the problem of air pollution. What strategies can we use to make these impacts more visible and convince people who might not be able to relate to the impacts in their everyday lives? That's a fantastic question. Don't know who wants to start with that one.
I mean, I can take it very quickly. So this is something we did a lot with the Mayor for Clean Air campaigning. We put up a pair of lungs that turned grey as they collected more air pollution, and that was a really good way of making it visible. And I know that there's been talk about putting them up in other places, not just in London, and other bits of London as well, and that was a really good thing we did. Also, the road signs I think were really good, just reminders that you are breathing this in, and just reminders that this is something that you're actually living with. I don't know if Jemima might want to add anything to that.
So there are lots of campaigns around that, and lots of campaigning ideas also on a really small scale. A friend of mine lives in Bloomsbury and had a filter on his son's window, and within 4 weeks that was completely grey. But I mean, there is always this talk about it being invisible. I think as soon as you stand a bit outside of London, on a place like in Forest Hill or somewhere, and you look into London, you actually no longer think it is invisible, because it does look so grey. And I think, yeah, so I think it is a mixture. We don't see it right in front of our eyes, but if you take a bit of space away from London and are a bit higher, you do really see how strongly polluted the whole area does look. So I think there can be more done with that kind of idea and images. I also think that, as LJ mentioned earlier, we got lots of contact from people who got in touch after the first lockdown and said, I used to always have migraine. I suddenly don't anymore. I had never linked these issues, air pollution, to my migraine and stuff like that. Like even my brother got in touch and said, Jemima, I'm no longer needing my inhaler. I didn't know that. I was like, your sister is an air pollution campaigner. You should have, you know. So I feel we should get out these stories much more strongly, where people can say, I went away on, you know, and I was better. So because we're not going to be able to focus on just showing it so much all the time.
Any other comments on that particular question about what are the best strategies for raising awareness and helping the public understand the real impacts?
I guess it just adds on to that. So I think the comments about doctors being clueless is absolutely true. There's a massive gaping hole in our medical education in this area in terms of climate change and also specifically air pollution. That is being addressed, particularly at medical schools now, and students themselves are driving that. They're demanding that their curriculums are changed, and that's been extremely powerful to make the institutions give time to this. And they're also educating themselves. As you know, there's so much available. There are such great student organizations that actually are producing amazing resources. So then there's this gap of doctors who already are practicing, who didn't have that, and also now are practicing and don't know. And so one thing that people who are interested are in is can raise awareness within their own hospitals and show that this is not a respiratory problem only. I think that's what is often a real misconception. This is not just respiratory illnesses. This is the whole life course, whatever specialty you're doing. This is relevant to your patients, and you should know something about it. And they will come with questions, but it's also on you to discuss with them what's going on. I had a patient last week who lives in Croydon, never smoked. We found emphysema on his CT scan, and he said, well, why? And I said, well, what jobs did you do? Are there any occupational exposures? No. We went through this whole list, and we were left with air pollution as the cause, and he was really shocked by that. And I then sent him to some resources to kind of look at that. You know, he's not someone who's going to move. This is not the solution. The solution is we all need to vote appropriately in elections. We need to talk to people we know that this is what the doctor told me, and make this much more of a normal conversation. So it's not on. I think there's a lot of work to be done by healthcare professionals to kind of get to grips with this and be more useful advocates and advisors. But I think making things visible, the arts projects, and having things like the lungs turning black and having the chalk on the paper on the pavement and having the signs, that actually is much better than me, you know, standing up and talking. Perhaps that they're very visible ways to really bring home these key messages that then lead people to go away and read more about it.
No, I think that's fantastic. I think that's absolutely right, and I think it actually bridges onto a couple of questions that we had that were relatively similar. And I don't want to dwell on the kind of medical side of things too long, because as we said, this is really a, you know, we want everybody on the team. But I think there have been a couple of questions about just an LJ, you mentioning you speaking to patients about air pollution as a risk factor or even a cause of their pathology, of their diseases. There's a question from Hayley and Lizzie that are kind of similar about how do you actually manage this conversation, and how do you discuss with people actually the you know, you live on a busy road, therefore air pollution is a risk factor for you, when we've already mentioned, you know, actually people can't really do much about that. What kind of advice can you really give in terms of how can they practically then manage their risk, and how do you have that conversation with people? That's not just specifically for LJ, but it might be helpful to hear from you, LJ, and others.
I would say it's a challenge, but that's true of all of these types of problem. You know, if I talk to someone about the fact that they live in a food desert and their diet is really poor quality, and actually that's really affecting their health, or the fact that they don't walk enough but they've got no green spaces nearby to do that in safely, or that their job is terrible and really physical and is ruining their joints, like all these things are kind of part of the same problem, in that we are really uncomfortable with talking about things we can't fix immediately. And that's again a problem with kind of how we see healthcare currently. We see healthcare as a transactional thing where someone comes to me, I'm expected to do something that then makes them better, and health is much bigger than that. And we need to start trying to shift the conversation to say, this is how I can support you to have as good health as you can, but also these are the ways we can work together in this community we live and work in to improve this situation. So I give them practical advice about avoiding peak times. I give them links to apps and websites that will show you pollution maps, and so you can plot your journeys so that they are on greener roads and less of the main roads. I talk to them about talking to their counsellor and writing to their MP, and I give them the link to They Work For Us, and I tell them this is something that, you know, that if they're worried about, which they clearly are, then it's something that they should tell their MPs about. And that's not a quick fix solution, and it sometimes feels a bit like, what are they going to do about it? But the more and more people make this something on the agenda, then it has to be listened to. And so it's multiple things, but I think it is important to talk beyond the immediate aspect of their own personal experience of their own health, and then look wider about how we as communities have responsibility to improve this for everybody.
Thank you, LJ. That's fantastic. I think it would be great if other health professionals followed your example. Any other comments on that particular question just before we move on?
I mean, patients often find their own solutions, and so please do chip in if there's anything else that you tell mums or that you tell your colleagues and friends, because a lot of the ideas I get come from patients. They've shown me an app or something, and then I save it.
Right, let's move on to the next question. I'm going to move away from the medical side of things, only because I think there's been a couple of comments, not really questions, but comments about just Pascal and Jemima. I think you both mentioned about, particularly Jemima, you mentioned about local councils kind of being the ones who should be spearheading local actions, but actually have been understaffed, under-resourced because of well, various political decisions that have been made in the last 5, 10, 20 years. Why do you think it's, and a comment from Richard, who I think we probably actually mentioned some of this on some of the chat, but why is it so important that we look at local councils, and actually what can be the role of community organisations such as, you know, Mums for Lungs, Choked Up and We Own It? What are the kind of different strengths and weaknesses that actually community groups can bring, rather than kind of relying on getting funding from central or local government?
So I'm a bit confused, and perhaps I was not quite clear. I think if we talk about stuff that is, you know, changing roads and stuff like that, we need, you know, there needs to be really clear evidence, there needs to be clear modelling, there needs to be insight. We need to know that the changes we want to see are actually feasible and so on, that the council can do it, has the powers, all of that. It's a lot of complex stuff. So I would argue that generally at the liaison, or the person, you know, the group organizing that whole process would have to be the council. And I think the council is also should be in a good place, isn't at the moment often, but should be at a good place and reaching out to more communities and to other groups and getting other people involved, right? You need a good website. I think I think in the UK, too much is relying on volunteers, charity sector, people who are understaffed, under-resourced, doing this in their spare time, you know, in often unpaid roles. I think that is very difficult. We want this engagement, but someone needs to be coordinating it. And I think that is where councils have been struggling in the past decade, probably, doing enough of that, reaching enough out into the communities, and having enough knowledge and insight themselves, providing enough information, making clear that for sure that information gets to everyone who's going to be affected and impacted, and everyone has the time and opportunity to understand the issues that are surrounding this particular aspect they want to work on. But then obviously, yeah, you want the community strongly involved, but someone needs to lead it, basically. That's what I think.
Pascal, I wonder if you want to come in and comment on that, if you have any experience to share.
So We Own It actually wrote a report a few years ago called When We Own It, How to Make Public Ownership So Successful That No Future Thatcher Government Would Ever Think About Touching Our Public Services. And we examined kind of best practice from around the world, and there was, for example, the idea, of course, that, you know, passengers and civil society, as well as unions and workers, should have representatives on, you know, the highest level of decision-making boards. We should have involvement in the decisions that affect our lives completely, and this should go right down to local council level. So our buses work on a very local level, for example, and so those decisions, we should be involved in them for sure. But I think that, yeah, Andy Burnham didn't make this decision out of the kindness of his own heart. Sadiq Khan won't make the decision out of the kindness of his heart, and they both need to be held accountable to their communities, because otherwise they're very happy to kind of just keep going as they were. So I think that community campaigning is absolutely vital, and is the way that change happens. So I think it's really important that we keep going on with that, and it can feel difficult. It's not nice to have conflict, and yeah, but it's important work to feel like a nuisance.
I love that line. I'm going to use that. It's important work to feel like a nuisance. I love that. That's that's a good motto for campaigning work. Thank you so much. We've got about 3 minutes left, and I wanted to give you all chance to just maybe have a quick 1-minute platform just to share some of your upcoming events. But I just quickly wanted to just also see if you kind of wanted a bit of a last word, anyone who wants to kind of comment on any of the questions we've had or bring up something else that we've kind of thought about during our discussions just in the last few minutes.
I guess just I wanted to say sometimes it can feel a bit like I sometimes feel some guilt and think, oh God, why haven't I been doing this already? Jemima's been working on this for years, like where have I been? And sometimes that can then put us off getting involved because we kind of think, oh God, we haven't done enough, we don't know enough. I've not been, thinking and speaking about air pollution for very long, but just being here, part of it is really important. So if there are any healthcare professionals out there thinking, God, I know nothing, there are some great articles, there are some great books. You can upskill super quick, and then you can really be part of the change that we need to see. So don't worry about thinking, God, where have I been lately? Just think, what am I going to do tomorrow? How can I be part of this? And always very happy for people to contact me. I'm easily findable on Twitter, where I am most days.
Thank you, LJ, for that call to action and encouragement. Any other last comments or just a chance to share some of your upcoming campaign and work? We will be sharing everything on the chat box, but just while you've got another minute to go.
If anyone else wants to send the London mayors any postcards about air pollution being an absolute priority, please email momsforlungs@gmail.com. I should have the link handy, but I don't. We've been sending out packs of postcards for people who want to make the urgency really clear.
Thank you, Jemima.
I'm just popping a link in the chat, taking it to a slightly different area, but here in the Northwest, we are trying to do our best to help drivers who are striking at the moment because their employers are cutting their pay, their sick pay in a pandemic, etc. And so any tweets of support for those drivers, wherever you are in the country, would be hugely appreciated. Because I think, yeah, building solidarity is really crucial to all of our work for better buses, for cleaner air. And thanks so much for having me. It's been amazing to learn from you all.
Yeah,
thank you so much.
Yeah, I just wanted to say thank you for hosting this discussion. It has been really quite incredible learning about what everyone is doing. And I guess my last message to everyone is just remember to keep your work intersectional and to go beneath the surface and examine the structures that are enabling whatever it is that you're trying to fight, and just see what those are and try and talk about them as well. Yeah.
Thank you, everyone.
That's fantastic. Thank you so much. I'm really, really happy to end on a note of kind of intersectionality, solidarity, and everyone coming together. So thank you so much to all.